Asthma. What exactly is asthma? Asthma is a respiratory disorder, a respiratory condition. It is generally more prevalent in children, and most children will grow out of asthma. Unfortunately, a few people, usually around about 5%, will go on to develop asthma into their adulthood. Rare occurrences, adults will actually develop a new condition of asthma in its entirety. There is also something called occupational asthma, which again is a condition very similar to asthma, but in the adult onset, in the adult population. Asthma itself is a situation where you have compromise of the airways. Remember, we have the trachea down the centre that separates into the bronchi, and the smaller bronchioles finishing off in the alveoli, i.e. the airbags. Now, the defect in asthma is actually in the airways themselves, so not so much in the alveoli. What happens is the smooth muscle that lines the alveoli, the airways, unfortunately, that becomes spasmodic. It's what we call bronchospasm. As such, when it becomes spasmodic, that spasm causes it to become thicker, and therefore the lumen, the airway itself, becomes compromised. So the space through which the air actually moves in and out during inspiration and expiration is reduced. Now, that in itself leads to wheezing. So I usually say, imagine a pen top. If you take a biro, take the pen top and blow through that, the little aperture through which the air is passing will become audible as a wheeze. That's exactly what happens. This is known as an obstructive respiratory condition, as compared to a restrictive respiratory condition, because there is obstruction of the actual airway through the airways. The category of restriction or obstructive comes on the back of lung function tests, including spirometry. What we do is, with asthma, there are some typical trigger factors, including cold weather, including exercise, and it usually is worse at night. Now, you can actually relieve the bronchospasm, and you do that by taking some inhalers. Now, inhalers, there are two types. There's a brown one, which is a preventative, beclomethasone, and you take 2 puffs every night and 2 puffs in the morning. And then the blue is the salbutamol, which is a preventer. This you take either before you're going to go and exercise, or when there's a recognized trigger, you take it before the actual activity so that you don't trigger the asthma, or otherwise when the asthma is triggered, you take that to actually treat the bronchospasm and allow it to all open, the airways then open. Taking it through a chamber is most helpful because it allows the actual substances to pass through into the lung parenchyma and further down, rather than hit the back of the throat. Thank you for watching.